morning, everybody. This is Dr. Raul Rodriguez, and welcome to Edge Radio Network and the Rodriguez Rejuvenation Show. I'm Dr. Raul B. Rodriguez, MD, medical doctor with a very unique practice, Rodriguez Rejuvenation, here in Dallas. I'm a cosmetic surgeon. I do cosmetic treatments, aesthetic treatments to make people look younger, feel younger, but also I incorporate lots of other modalities to help people function like a younger person. I mean, what good is it if you're looking good, looking young, but you still feel like an old person? I have my beautiful, lovely, charming co-hostess here, Miss Sarah Ross, with me today, and we're going to be talking about something that you will not hear any of the doctors that you go to talk about. So if you're tuned in today on the radio, on our AM channel, or on FM, or tuned in to us here on Facebook for our live, get your friends on board. Send them a message, send them a text, tell them to come on board, because I've got information with you that your doctors will never share with you. Mostly because they don't know. Secondly, but more importantly, they don't have the time. Okay? So these are things that are going to be very crucial to help people look good, feel good. And what I wanted to talk about today was the fact that women need testosterone too. Women need testosterone too. Did you know that, Miss
No,
Mary?
Doc, I did not. Why is this so important to us women?
Well, you hear men talk about testosterone. They got testosterone that makes you, bold, and
Some have too much.
helps you build your muscles and all this other good stuff. But testosterone is just as important to women, even though women have maybe a fraction, a tenth of what a man would normally have. That little bit, and hormones work in miraculous ways in the body. You don't need a lot of hormones. You just need a little bit of the right hormones and the right balance.
The perfect balance.
And perfect balance. And that's one of the things that we do at Rodriguez Rejuvenation with hormone balancing. But that little bit of testosterone that women have, if that's a little bit off, it can make a world of difference in how you see life, how you see the world, and how you're going to feel now and for the rest of your life.
How so?
Well, have you ever come across anybody, women or men, but women, because women got a lot on their plates, they just feel kind of blah.
Yeah. I felt like that sometimes, Doc.
Well,
It's like, let me try this day over again.
exactly. And do most women go to see a doctor for that?
No.
No.
Not for that, only because we just related to maybe just stress.
Right. How many people? How many women? Maybe 10%?
Yeah. Statistics actually show about 10%
There you
really
go.
only go to see a doctor
There you
for
go.
that particular symptoms. We
Yeah,
go
there
to see
you go.
doctors for everything else.
Because they think it's normal.
Yeah.
Because they think it's normal. And it's not normal. I'm going to just mention this. I have this cute little patient, this petite little lady. She was 55 when she started coming to me, and we put her on testosterone to balance her hormones out. And she's from Beaumont. She'd actually come in from Beaumont to see me in the practice. And she would hang out with her other 50-something-year-old girlfriends. And she was telling me, yes, Dr. And she had a little squeaky, mousy voice. And, yes, Dr. Rodriguez, I've been telling all my girlfriends that they just don't know how good they used to feel.
She has a magic touch.
Because it made a huge difference in her life. But this is something that can happen at any point in time. And most women, like you said, they feel it's normal. They got this going on. They got 1,001 things to do. They're trying to multitask. And they talk to their girlfriends, and they all feel the same way. So, hey, this is normal.
Yeah. And it's not.
It's not. It's
How?
not.
Can having low testosterone affect your sex life?
Low testosterone can certainly affect your sex life. Now, that's the thing that many people may have heard about, is testosterone being used to improve libido. Mm-hmm. Because it's done for men a lot. You have a lot of these men clinics out there that are giving testosterone shots, and you hear about them on the radio and all that stuff. And it does help to boost your libido. So it certainly does that, in addition to having other benefits. But when a woman is feeling kind of blah, the sex drive may not be what it used to be, or what they want it to be. But so is every other aspect in their life. It's not the way that it's supposed to be, or the way they want it to be. They feel the kids are running them ragged. They feel they don't want to go into work. They don't want to take care of things they need to take care of, whether it's doing your taxes or taking care of your home, so not want to take care of your man or your partner,
falls right in line.
It falls right in line. Just part of the blah syndrome, as I like to call it.
So, Doc, how do we know when it's time to get testosterone, or even just talk to the doctor? Okay, I feel blah. I think it's normal, but at what level of blahness should I come see you?
Well, whatever level of blahness. If you don't like the way you're feeling, you need to come see me. Simple as that, and then we can assess and see what's wrong. For many of the patients that come to see me, the first thing that happens, only 10% will actually seek medical treatment. They'll go to their doctor will do some blood tests, do a CPC, make sure they don't have anemia. They'll do a CMP, a comprehensive metabolic profile, to make sure that they don't have, the sodium, potassium, and all. They'll do a thyroid test, because thyroid hormone, if it's low, can also make you feel kind of tired, and it can also make it a little bit more difficult for you to lose weight. And we're going to touch on that when we also talk about thyroid and testosterone. It's not just one T, but two T's. That can make a big difference when it comes to weight loss as well. But when the woman goes to see a doctor's doctor, I'm not feeling good, they get all these tests, and of course those tests, they look okay. They don't have blood chemistry problems. That's not the issue there if you just check for potassium and sodium and how many red blood cells you got floating around in your body. But what about the important chemicals in your body, the hormones in your body? And you've heard me talk on the show about the fact that we don't lose our hormones as we age.
Yes.
We age because we lose our hormones. But when most of my female patients come in, they tell me that they're on a slew of different antidepressants. Not all at once, but they all have some kind of antidepressant that they get put on. They feel, the doctor looks at all the blood tests, this looks okay, this is okay, you don't have anemia, you don't have maybe just a little depressed. Let me write you a prescription for an antidepressant. And antidepressants are very common. I mean, you probably know lots of friends, young and old, that are using antidepressants because they feel blah, they're not happy with their life, they feel sad, they feel run down, they feel worn out. And
it seems doctors only either put you on antibiotics or antidepressants.
What?
we have some more options.
There you go. So there's some more options for you. So when all these things check out, nobody is telling them, maybe your testosterone is off a little bit. And the thing that's really important in women is that since women don't have a lot of testosterone, but testosterone in women, the little bit that they have, is the most biologically active hormone that's floating around in their body.
Really?
Testosterone can affect your energy levels. It can affect your mood. It can affect your ability to focus and concentrate clearly.
Now, how many different ways are we able to receive testosterone?
Well, there's lots of different ways to receive it. The most common way to receive testosterone is very simple. It's in the form of a cream. You can just apply a little cream on the skin after you take a shower. But then you have to make sure that you're not coming in contact with children and things like that for women. And many women forget to use birth control pills too. That's why there's implants. Sometimes people will have a little implant for birth control. The most convenient way to get the testosterone, like the birth control,
I'm listening, Doc,
is an implant. A little tiny implant about the size of a long grain rice that's just put underneath the skin in about a 10-minute procedure, have you feeling great for months.
So is this technically...
These are called hormone pellets.
Okay. I was going to ask you, is that technically called hormone replacement therapy? Is that
hormone replacement therapy is just a matter of getting your hormones back to where they need to be. But the thing now is we have pellets, little tiny compressed hormones that we just put underneath the skin, and it gradually dissolves over a period of several months. So you don't have to worry, like for your birth control, did I remember to take my birth control pill yesterday? Women get the...
We all do that.
Yeah, a lot of women get the birth control implants so that they don't forget, So these things, it's kind of like, there's that infomercial on TV. I forgot what the guy's name is. He's this little chubby chef. But they used to have a commercial with this cooking devices that just set it and forget it.
it.
Set it and forget it. Set it and forget it. That's the way it is with hormone pellets.
Sure.
You know, you come in, it's a quick 10-minute procedure, just done with local anesthesia. Doesn't really leave any scars or anything like that. Just we put it right underneath the skin. We set it there
And forget it.
and we forget it. That's all you need to do.
So you mentioned cream pellets.
Pellets.
Is there any other way?
And injections. Injections are a very common way to replace testosterone. The injections come in a kind of an oily solution. You have to inject it intramuscularly in the muscle, which hurts a lot. Sometimes it can cause knots to form because putting oil into the muscle can cause some degree of irritation, inflammation. Sometimes people develop little fibromas or little knots in there. And nobody likes to, since it's kind of an oily preparation, the needle has to be kind of big because if it's a little skinny needle, the oil isn't going to squirt through there. So the needles are painful, and a lot of people don't want to have to deal with having weekly injections into their butt muscle, which is where it's typically done, or sometimes twice weekly. So we have to do more often for men. So people are looking for convenience nowadays. You know, whether it's in your shopping, whether it's in your car care, whether it's taking care of your home, people are looking for convenience. And we talked about the fact that the most important possession that you have, that you can't change, you can't trade it in, you can't sell it like a house if you get tired of, living in it. You can't get it for a newer model like you can with your car. Your most valuable possession is your body.
Yes, it's yourself.
So put the same degree of thought into keeping your body optimal. Much more thought than you put into keeping your house looking its best or keeping your car running its best. Because it's much more valuable, and guess what? Nobody's going to take your body on a trade-in.
And ladies, you hear that? If you have any questions for the Dr. Rodriguez, give us a call at 281-587-1540. You never know, you might actually be going through this, and at this time you can kind of spread your malfunction without having to put a face to it, less embarrassment. So, if this sounds like your malfunction, give us a call. You could possibly answer some questions. Okay. Doc, I have a question for you. Sure. At what age does this start?
It can start usually in their 20s. And so they're starting in their 20s. Usually by the time you're 20, 25, your hormone levels are as good as they are going to be. They're optimal. So if at that point you still have something that's off a little bit, then it's not too early to start addressing it, especially when you got a long life ahead of you. There's no reason to be the next 20 years wait until you're 45 to start doing something because you haven't been feeling good for 20 years.
Wow.
There's no excuse for that nowadays when we have such good options available now.
Are there any other symptoms besides feeling blah and lowering the sex drive?
Lowering sex drive, other symptoms are feeling depressed, mood disturbances, that blah feeling. What happens when you go to a doctor and they put you on some antidepressants? And most antidepressants are safe, but do you want to be on an antidepressant and increasing dosing and all that if you don't want to need an antidepressant? You've got the proper brain chemicals in your brain to do the job, but it's just that your brain isn't utilizing them optimally. Okay? You can have a whole lot of something, but if you're not utilizing, most of it's going to waste, you're not going to get the benefit. And what testosterone does for men and women when they're feeling depressed and have that blah feeling is it helps the brain cells work better. When the brain cells work better, all those chemicals that keep you uplifted, that we have to use antidepressant medications for to get to that uplifted feeling, all those chemicals that are already there are working better for you. Now, because your brain cells are working more efficiently, utilizing everything the way they're supposed to, that's also why focus, concentration, memory may even be better. Now, if you're at your job, you can function better because your brain is functioning more clearly. You don't have that brain fog that you hear people talk about. And that's something that's very common. And what do we do when we have brain fog? We go get another cup of coffee. Or in some cases, some people go for getting some stronger stuff that they got no business getting that's going to get them addicted. Okay? But that's not the solution. That's not the way God meant for your body to function. That's not the way God meant for you to feel. And we have healthy, simple, safe solutions to that blindness, to those depressed moods, to that lack of energy, that lack of focus, that lack of concentration that keeps you from getting a raise at your job, for crying out loud. So these have real positive, real life implications on the quality of life for women and for men.
So, Doc, I'm trying to remember all my thoughts. I have so many questions for you. The fact that mind, body, and soul works all together, can a past sexual experience affect future production of testosterone?
Typically, no, unless it's caused some sort of significant trauma. By that, I'm talking about where you lost your ovaries. Because what's one of the most common operations that women have when they get a little older and then they've already had kids?
Hysterectomy.
Why? Do they take out your uterus?
Listen, Doc, we have strong menstrual pain. So you know what? We already gave you the baby. Time to go. Take it out. And that's just what we want.
And while we're there, since you already had the babies, you don't need those two little round things
we
sitting
don't
on the
want
end
it.
of that.
We don't want it.
So they take your ovaries too. And what a lot of people don't realize, after women have hysterectomies, it's one of the most common operations that women have, that are postmenopausal. They've already had their kids. In some cases, even young women. I've had women in their late 20s that have had hysterectomies because they had painful uterine fibroids and very heavy bleeding that cause them to have anemia all the time.
Yeah.
So even younger women will often have to have hysterectomies. Most good gynecologists that are very thoughtful will preserve the ovaries in most cases. Okay?
Some gynecologists are rude, Doc, because I've been trying to get this stuff taken out since I was about 14. They told me no. Since you don't have no kids and you don't have no husband, no.
and even for that now, there's ways to actually take care of fibroids without taking the whole uterus. A fibroid is just a muscle tumor. It's a benign tumor that grows in the muscle of the uterus, and the uterus is just a muscle. And so since it's benign, it can very safely be operated, cut out. Sometimes they have some techniques where they inject something to cut off the blood flow to the fibroid, and that makes it shrivel up and shrink down in size, so it's not painful anymore. So there's lots of options available to take care of the fibroid problem. But sometimes when the fibroid problem is taken care of with the hysterectomy and the ovaries are taken out, you're 50-something years old, you already had kids and all that. If we take your ovaries out, then they'll never get ovarian cancer.
Yes.
Well, if we lop off your breast, you'll never get breast cancer either. But is that the right thing to do?
No.
No.
And you mentioned breast. Does the testosterone affect breast cancer? Does it have anything to do with that?
It does affect breast cancer. We'll touch on that. But the point that I was trying to make with the hysterectomy is that when you take the ovaries out, and most doctors don't realize this, but your testosterone level drops when they take the ovaries out. Your testosterone level dropped, even though nobody messed with your testicles because you don't have any testicles. But the ovaries are also responsible for and involved in the production of the small amount of testosterone that women have. So what do they do after hysterectomy? Your hormones are off. They put you on some estrogen, which is the main female hormone. But estrogen helps with mood. It may help with other issues. Yes.
But too much is not good, Doc.
No, too much isn't good. And good doctors will put you on the right dose of estrogens. What we do in our practice is we use bioidentical hormones, which are chemically identical to what God put in your body, so that it doesn't have the high risks of developing a breast cancer or uterine cancer, ovarian cancer down the road, like the synthetic estrogens that many women have been put on.
How would we know the difference?
Well, you ask your doctor. You need to ask questions. You need to be an informed consumer. Whenever you go to your doctor, especially nowadays, since doctors really can't spend as much time as they want to. Doctors, most of us overwhelming majority of us are very good at heart. We want the best for our patients. But now, to even get paid, you have to fill out a whole slew of forms, or you have to be online punching with your little two fingers. You never went to school to become a court stenographer.